The Food and Health Bureau has long supported local research in health and medicine through various funds. In 2011, the HMRF was created with an injection of $1 billion by consolidating the two former funds. In 2016, the Legislative Council Finance Committee approved to increase the commitment of the HMRF by $1.5 billion and to incorporate the Healthcare and Promotion Fund into HMRF. The Bureau has initiated and supported a series of commissioned studies to provide scientific evidence to guide our healthcare policies and service provision.
My team of researchers has been commissioned by HMRF to carry out two large-scale studies in cancer prevention. The first study aims to develop a risk prediction model of breast cancer specific to Hong Kong women. We plan to validate a method for more tailored prediction of risk that will inform breast cancer screening policy for the local population. In the second study, we evaluate the effectiveness and efficiency of government's colorectal cancer screening pilot program.
Population aging is presenting challenges for and generating demands on our health and social care systems. The HMRF Commission study is to review the range of healthcare services supporting elderly with chronic diseases and to identify key pressure points in the present healthcare system. One important part of the study focuses on end-of-life care. We will be making recommendations to enable the provision of appropriate care in the community setting for patients to have a choice of dying in place.
The 5-year commissioned research undertaken by the Department of Microbiology focuses on virology and bacteriology. Priority areas for research include the pathogenesis of emerging and re-emerging infectious diseases. With support from HMRF, we are developing novel genomic, transcriptomic, and lipidomic technologies to understand, treat, and ultimately prevent a wide range of infectious diseases.
The development of a new drug has to undergo at least 7 years of clinical trials in human subjects. Our Phase 1 Clinical Trial Center at the Chinese University of Hong Kong was supported by HMRF over 5 years to develop essential research infrastructure, which is very important to strengthen the clinical research and development of new drugs in Hong Kong.
The HMRF also supports investigator-initiated studies.
Thank you for HMRF for supporting our studies on health behavior.
We have investigated the association between peer influence and the health risk behavior of secondary students.
The Health and Medical Research Fund supported our researches in traditional Chinese medicine. We conducted clinical trials to evaluate the safety and efficacy of Chinese herbal medicine for the disease such as irritable bowel syndrome, functional constipation, and ulcerative colitis.
The HMRF supported our research on the risk assessment and public health control for infectious diseases. We developed a simple method that can be easily integrated into existing influenza surveillance systems. Our finding is important for informing optimal use of antivirals for mitigating influenza epidemics.
With the support of the HMRF, we pioneered the use of proton magnetic resonance spectroscopy as a rapid, safe, and quantitative assessment of intrahepatic fat for the diagnosis of non-alcoholic fatty liver disease.
Besides, the HMRF also builds research capacity among early and mid-career researchers through the Research Fellowship Scheme.
As a junior researcher, I'm glad to receive the support of HMRF Research Fellowship Scheme for my training in Mendelian randomization from a renowned epidemiologist and apply this novel epidemiologic study design in my research.
Healthcare and Promotion Fund aims at supporting health promotion programs in the community.
With the support from Healthcare and Promotion Fund, we have organized various programs on health promotion for young people, aiming at raising their awareness on mental health, reducing stigma, and to increase the acceptance of people in recovery in the community.
To promote the culture of healthy eating, we have delivered a wide range of healthy eating and promotion programs to different corporations and organizations with the support of Healthcare and Promotion Fund.
In April 2017, the HCPF was incorporated into the HMRF and was renamed as Healthcare and Promotion Scheme. We are confident that the consolidation will create synergy and promote better health outcomes for the people of Hong Kong. These research findings are widely disseminated to local healthcare professionals, academics and policymakers. We could not have achieved this success without the help of the governance bodies for Health and Medical Research Fund and Healthcare and Promotion Fund. Let's join hands to improve the health of our population through the latest scientific evidence and research findings.
Thank you.
Thank you.
Thank you.
Health and Medical Research Fund.